I want to know what the role of the imaging in the planning of the treatment. I think it's a crucial role because firstly, once the oncologist or treating physician knows the diagnosis, they want to know the staging, and they need to do the imaging to get the staging. Once they've got the stage, they can decide from there which is the best modality. Is it chemotherapy? Is it immunotherapy? Is it radiotherapy? Is it surgery? And that is all based on the imaging. Biopsy needs to be done when there's suspicion of diagnosis, but it cannot be confirmed with certainty on an imaging modality. So especially in oncology, if you suspect there's a malignancy, you want to confirm that. If you suspect that it's an infection, you don't need to do a biopsy. You can treat it and follow it up and see that it resolves. So in general, when there's a suspicion that something may be malignant, that's the indication to do a biopsy. Then we have to have a look on the clinical evaluation and all the imaging. Where exactly is this lesion? How safe is it to do biopsy? And what is the ideal technique? You want to do it minimally invasive. You want to do it without pain or discomfort, and you want to do it safely without causing damage to adjacent tissues or organs. So more and more these biopsies are done by radiologists because we can do it under image guidance, and because we can see where we're going, we can be very accurate in placement of biopsy needles, for instance, and we can be very accurate in avoiding other organs and vessels. With the imaging that we use, it's more and more accurate, and therefore it's becoming more and more a modality that's used by the radiologists. So the next question is which radiologists do that, or do all radiologists do biopsies? I think most of us in radiology do biopsies. There are some that are less comfortable, and some are more comfortable. So it all depends on your inclination and your experience and what you prefer to do. But most radiologists can and should be able to do the basic biopsies. But simple biopsies, if you've got something just underneath the skin that you can easily see and feel, and it's easy to get a needle in there, we can all do that. It becomes more complex when you're trying to biopsy something that's in the lung or deep within the liver, and you've got to use more skills to get at it, and we leave those to the interventionally trained radiologists, and so we can get the optimal result. So there's so many different types of procedures. The ablation therapies would generally entail a patient under image guidance, usually with sedation or anesthetic, or with freezing of the tissue, which is a cryoablation. But other patients where we're not treating the cancer itself, but treating the effects of cancer. For instance, if you have a tumor causing a bile duct obstruction, and one can then use intervention to bypass that obstruction of the duct.